Hello, everyone. Welcome back to the end of this meeting, end of today's meeting, indeed the end of this year's Parent Symposium. And I just wanted to say a huge thanks to all of you for joining this meeting. If there are any of you wondering, who is this guy? Why is he talking to us? I'm Dr. Morgenstern, Daniel Morgenstern. I'm a pediatric oncologist in Toronto. I was here at the beginning of the day. You may remember all the way back there. And I just wanted to kind of give some closing thoughts to wrap up this day and wrap up this meeting. So first of all, a huge thanks to all of you for joining. Thanks to all of the speakers from around the world. As I mentioned this morning, I think the organizers of this meeting have done a fantastic job in getting together a really excellent group of experts. And it's to me, one of the amazing things about this meeting is how it consistently manages to get some really great researchers, clinical and basic science researchers together so that you can hear directly from them. And I hope ask your questions and begin to understand more about what we're trying to do. Of course, I want to thank the supporters, YMABS, Norgine, Sanofi, EUSA Pharma, United Therapeutics, and GRC World Forums, who have provided this online platform that we've used again this year. And of course, all of you for joining in with all of the sessions and asking so many questions along the way. A few final things to let you know is that all of the sessions from today have been recorded and will be available on this website even after this meeting. So if there's things you've missed during the day or things you want to go back at and look at, including from previous meetings, because obviously it wasn't possible to cover all topics in today, there is a big and growing library of talks online there, so you can go back and look at those anytime you like. No meeting, of course, is complete without feedback forms. So you'll be pleased to know that there's already a feedback form online that you can go now ideally and give your thoughts. So if you go to the main menu on the left-hand side, you can see an option for filling in a feedback form. And I think the organizers will be in touch with you by email as well to give you an extra opportunity to fill that in. It is really helpful for us to know how the meeting has gone, what has been useful, what you liked, what you didn't like, so that we can begin to take that into account for future years. So I just want to then kind of talk through, well, what did we hear today? Where are we at and where are we going in neuroblastoma? And, you know, inevitably, most of this meeting focused on high-risk neuroblastoma, because as I explained at the beginning of the day, those patients with metastatic disease or those patients with MYC amplification with high-risk disease are the most challenging to treat and clearly already go through very complex therapy with outcomes that are, you know, really not perfect. And so we heard at the beginning of the day about how both COG and SciPen are developing their protocols for high-risk neuroblastoma. We spoke about this concept of bridge therapy or extended induction, because there are some patients whose disease does not respond well to initial chemotherapy, who maybe would benefit from extra chemotherapy or extra chemoimmunotherapy before going on to high-dose chemotherapy. And that topic of chemoimmunotherapy, we also covered the background to that, how originally that's been tested in the relapse and refractory setting, and now we're on the cusp of bringing that more routinely into upfront treatment to see if that can improve response rates in the short term and outcomes in the longer term. And of course, we also heard about targeted therapies and this idea of trying to find particular abnormalities in neuroblastoma cells that allows us to target them more precisely with treatments. In the second session, we covered CAR T cells, and I think, you know, everyone's aware that CAR T cells have been a huge success in leukemia, and childhood cancer was able to lead the way globally in making CAR T cell therapy available as a routine treatment for patients with relapsed leukemia. The journey in solid tumors has been a lot more difficult because it's just a lot more challenging to make the technology work for solid tumors. But we heard about a variety of different approaches and a variety of different studies using CAR T cells against different markers, against GD2, against GPC2, against FOX2B. And we also heard about different types of cells, NK T cells, which are a little bit different from T cells, as another type of cell that we can also use this CAR technology in. And so I think this is a really exciting field. It's kind of early days at the moment to know how well is this going to work, how well are we going to be able to make this work. And clearly it's still very experimental, but it's certainly an exciting area of research. And then in the final session, I think everyone was picking which direction they were going to go in and which sessions they were going to join. And there was discussions, of course, about the role of anti-GD2 antibodies, where we've come from with those, and where are we going next in terms of how best to use those antibodies. What other combinations might we begin to use those with? Maybe with MIBG therapy, maybe with anti-CD47, which is another immune drug. And we spoke about the possible ways of using that technology, which is now embedded in our standard upfront treatment, to try and improve the outcomes for patients with relapse or refractory disease. And in parallel to that, and I think a really important theme is that the treatments that we're using at the moment, we know are incredibly toxic, and there are significant late effects from those treatments. And those late effects are not necessarily just pure medical late effects in terms of problems with the heart or problems with the kidneys or problems with the hearing, but there's also a whole lot of issues which, to be honest, as a doctor, I won't pretend to understand, because I've not been through it, and I've not lived that experience as a parent, as a family, having to go through this. But I think the psychological trauma of going through the treatment, of going through this experience, coming out the other side, and then carrying on with life, I think is not to be underestimated. And so I think that's a really important topic for discussion in this sort of meeting, because getting through treatment is one thing, but getting out the other side and carrying on is another, and is equally difficult and important. And finally, I think it's important to recognize there are a lot of topics that we didn't cover in detail today that maybe weren't presented on today, and that's just because it's impossible to cover the whole spectrum of research that's going on in neuroblastoma in one meeting, and we wanted to focus this meeting on just one day to make it easier for people to participate. But there is lots of extra information on these other topics online on this website, in the recorded sessions from previous years, or even some extra recorded sessions from this year. So if there are other topics that you feel were not well covered this time, please have a look at those pre-recorded sessions, and also please drop a note in the feedback to say to us, I really want you to cover these topics in future years, and we'll do our best to take that into account. So I think that's everything I wanted to say, other than to thank you all again for joining the meeting and to listening to me summing everything up, I hope in some sort of coherent way. Thank you again to the supporters, and thank you especially to everyone at Solving Kids Cancer, who've put in all the work behind the scenes to make this meeting happen. It really is a lot of work on behalf of all of us who've joined the meeting. Many thanks to them for all their work in putting this together. And so I'm going to stop talking now, and I'm going to leave us all with a video montage of patients from around the world and their families who've been affected by neuroblastoma. And I'll leave you all, and hope to join and talk to you all again next year, either in person or online, when we have the next Parent Global Symposium. Thanks very much.